My name is Dr. Lisa Gfrerer, and I'm a peripheral nerve surgeon, and this is Dr. Meryl Hazewinkel, and she's doing a PhD in headache surgery. We want to provide some patient education on headache surgery and what it means to have nerve compression around the head and face. First of all, why is a peripheral nerve surgeon seeing patients with headaches and migraines? Well, over the past 20 years, it has become clear that patients who have a diagnosis of migraine or different types of headaches can also have nerve pain. How do we differentiate these types of pain? Well, it's not simple, but nerve pain can be distilled down to certain few factors that I will explain to you so you can understand better if you have nerve pain. The first is that the pain starts at a very specific point every single time, and then the pain radiates into a certain direction. The pain can be sharp, burning, stabbing, tight. It can feel like a band around the head. Sometimes you can experience sensory loss, and oftentimes the pain can be accompanied by migraines or headaches, and you can experience a lot of similar symptoms as when you're having a migraine and a headache, including the aura. We will go over all the nerves that can be involved in nerve pain of the head and face, and I will show you the starting point and radiation pattern of these nerves. We'll start in the front first, where we have the supraorbital and the supratrochlear nerves. The pain usually starts at the mid-eyebrow, but it can also start a little higher up on the forehead, and it radiates upward or around the eye or towards the temple. We have nerves on the side of the face called the zygomaticotemporal nerve in the non-hair-bearing area of the scalp, and the auriculotemporal nerve in the hair-bearing area of the scalp. Typically, the pain starts at one specific point and can radiate to around the eye or also towards other areas of the scalp. And then at the back of the head, we have the greater occipital, the less occipital, and the third occipital nerve. The greater occipital nerve pain starts here at the back of the head and radiates to the front towards the forehead. It can also radiate across the forehead and to behind the eye. The less occipital nerve starts a little bit more to the side and oftentimes radiates to the ear, but it can also radiate toward the forehead. And the third occipital nerve is more in the midline of the occiput. In addition, we have the rhinogenic trigger sites where there is a contact point in the nose, and oftentimes that pain can be felt behind the eye. And then there are nummular trigger sites which can occur at any point across the scalp, and it's typically either an elliptical or a round area, and it's just constant in one spot.